Pain after hernia surgery is very common, whether it is done by laparoscopy or by open surgery. But the pain is much less in laparoscopic surgery repair. Hi, I am Dr Rajasekhar Reddy. I am surgical gastroenterologist from Apollo Jubilee Hills Hospital, Hyderabad. So I will tell you the tips and tricks of how to manage post-operative pain in patients who have undergone laparoscopic hernia repair. The first thing is you have to avoid straining too much after surgery. Usually the pain after laparoscopic hernia surgery lasts just for 2 to 3 days. If you have any pain more than 3 days, then you have to consult a doctor. Certain things which you have to do, which you don't have to do, I'll let you know. You have to avoid straining too much, like avoid immediately like lifting heavy weights, avoid cough, because if you cough again there will be pressure on the suture line where we put the ports. So that will cause you pain and also that will increase your post-operative stay at home. Avoid smoking also, though smoking is not good for health, it also impairs your wound healing. So if the wound is healing is not that good, they may have to stay longer in the hospital, longer in the house, and the early return to work is not possible, and then the hernia chance of recurrence of hernia is more in people who continue to smoke post-operatively. Also, I'll tell people who have constipation, please try to avoid constipation. Try to use good high fiber diet, good water intake is important, and then take timely fruits and vegetables, lots of curries to avoid constipation. Because if you have constipation, then again there will be abdominal distension. You try to strain while passing stool. When you are straining, you will have pressure on the suture line. So there is chance of recurrence during this process. So always try to avoid constipation. Also, I'll also tell you to avoid lifting weights, because if weights of 1 or 2 kilos is fine, but max is 3 to 4 kilos. But if you lift more than 3 to 4 kilos, again there will be pressure on the tummy. It means there will be increase in the intra-abdominal pressure. If there is increase in the intra-abdominal pressure, then the chance of recurrence of hernia is more. So you should not lift any weight more than 2 to 3 kilos maximum. And that too, usually first 1 to 2 years you should be very careful. But I'll tell, if the patient who has undergone multiple surgeries for the same problem, it's always better to avoid lifting weights for life, especially like people who are doing gardening, lifting flower pots, or people who are lifting water cans like 20 kilo water can or a gas cylinder at home. So all those things need to be avoided for life if you don't want to have any recurrence of hernia. I also advise sometimes people who are very obese or people who had multiple surgeries, better to have a abdominal binder. It's called abdominal belt. It is a very soft belt which helps to give some counter pressure to your tummy, and it's useful when you are getting up or when you are at work. There is no need to wear the abdominal binder when you are lying down. Just wear it when you are going for work or when you are climbing up the stairs, like that. That also for just few days, maybe I can suggest you maybe for few weeks, first 2 to 3 months is fine, to avoid the unnecessary complications associated with this hernia. Other thing is, please don't put on weight. People who have undergone hernia surgeries, most of them who we see are like obese people, and then this obesity always worsens the complications. So don't think that you have undergone surgery and you have to eat more, you have to take rest. It's not like that. You have to keep on working within your limits of pain, and then try to maintain your weight, diet, strict diet, and little exercises, whatever we teach, before you go to a regular normal exercise, just follow them, you'll be perfect, you'll be normal. But don't do unnecessary straining exercises. Like if you do, like abs, like people who have undergone abdominal surgeries, laparoscopic hernia repairs, abdominal hernia repairs, don't start going for, abs, head rising, leg rising, and then not tummy exercises for first few months till you consult your own doctor. We will tell certain exercises which you can do, like do brisk walking, you can do cross trainer, you can do mild weightlifting exercises like that, but not like any exercise which will add pressure on your tummy like abs and all those things. We'll advise when to do, when not to do. That's very important. Please don't put on weight. Maintain your regular weight, and you have to check your BMI, body mass index, like check your height and weight, and depending on that you can consult your doctor and check your BMI, and then you can maintain the weight. So that's very important. No obesity, no cough, no constipation, no smoking. These are the secrets for your which help to avoid recurrence of hernias. Thank you.